Anxiety, depression, tension, or stress causes, symptoms, and treatments. I am Dr. Naeem, and welcome back to my channel. Today, we will discuss a crucial topic affecting millions worldwide: anxiety, depression, and tension or stress. I'll explore their causes, clinical symptoms, and evidence-based treatments. Let's dive in. Understanding anxiety is a natural stress response. However, when it becomes excessive or persistent, it can develop into an anxiety disorder. Causes: genetic predisposition, biochemical imbalances, such as dysregulation of neurotransmitters like serotonin and dopamine, psychological factors, and environmental stressors. Symptoms: persistent worry, restlessness, tachycardia, hyperventilation, muscle tension, and difficulty concentrating. Treatments: cognitive behavioral therapy, CBT, pharmacotherapy, SSRIs, benzodiazepines in controlled cases, mindfulness-based interventions, and lifestyle modifications. Anxiety disorder is a broad term that encompasses various conditions characterized by excessive fear, worry, or nervousness that interfere with daily life. While occasional anxiety is a normal stress response, anxiety disorders involve persistent and overwhelming feelings that are disproportionate to the situation. Types of anxiety disorders: generalized anxiety disorder, GAD, chronic, excessive worry about everyday concerns such as health, work, or finances, often without a specific trigger. Panic disorder, sudden, intense episodes of fear known as panic attacks, which may include heart palpitations, sweating, dizziness, and shortness of breath. Social anxiety disorder, intense fear of social interactions, leading to avoidance of social situations due to concerns about embarrassment or judgment. Specific phobias, extreme, irrational fear of certain objects or situations, e.g., heights, spiders, flying. Obsessive compulsive disorder, OCD, repetitive thoughts, obsessions, and behaviors, compulsions, aimed at reducing distress. Post-traumatic stress disorder, PTSD, develops after exposure to a traumatic event, causing intrusive thoughts, flashbacks, and heightened anxiety. Causes of anxiety disorders: neurochemical imbalances, dysregulation of neurotransmitters like serotonin, dopamine, and gamma-aminobutyric acid, GABA. Genetic factors: a family history of anxiety disorders can increase susceptibility. Environmental influences: stressful life events, childhood trauma, or substance abuse. Personality traits: people with high neuroticism or perfectionistic tendencies may be more prone to anxiety. Medical conditions: chronic illnesses such as thyroid dysfunction, cardiovascular disease, or respiratory disorders can contribute to anxiety symptoms. Clinical symptoms: persistent worry or fear, restlessness or feeling on edge, fatigue and difficulty sleeping, increased heart rate, tachycardia, shortness of breath, dyspnea, excessive sweating, hyperhidrosis, gastrointestinal disturbances, nausea, diarrhea. Treatment options: psychotherapy, cognitive behavioral therapy, CBT, helps individuals identify and modify negative thought patterns. Exposure therapy, gradual exposure to anxiety-inducing stimuli reduces fear response. Pharmacotherapy, selective serotonin reuptake inhibitors, SSRIs, commonly prescribed for long-term management. Benzodiazepines, alprazolam, bromazepam, used in acute cases but carry a risk of dependence. Beta blockers help manage physical symptoms such as tremors or palpitations. Lifestyle modifications: regular physical activity, mindfulness, meditation, and relaxation techniques, avoiding caffeine and alcohol, maintaining a healthy sleep routine. Anxiety disorders are treatable, and early intervention improves outcomes. If you or someone you know is struggling, seeking professional help is crucial. Understanding depression: major depressive disorder, MDD, is characterized by prolonged feelings of sadness, worthlessness, and anhedonia. Causes: neurotransmitter imbalances, hormonal changes, chronic illness, genetic vulnerability, and psychological stressors. Symptoms: depressed mood, fatigue, insomnia or hypersomnia, loss of interest in activities, changes in appetite, suicidal ideation in severe cases. Treatments: antidepressant medications, SSRIs, SNRIs, atypical antidepressants, psychotherapy, CBT, interpersonal therapy, electroconvulsive therapy, ECT for treatment-resistant cases, and lifestyle adjustments. Understanding tension and stress is the body's reaction to a challenge or demand. Chronic stress can lead to serious health complications, including hypertension and cardiovascular disease. Causes: work pressure, financial strain, unresolved conflicts, and trauma. Symptoms: muscle stiffness, irritability, cognitive impairment, sleep disturbances, and elevated cortisol levels. Treatments: stress management techniques, meditation, deep breathing exercises, pharmacologic intervention if indicated, and mental health is as vital as physical health. Herbal remedies: chamomile. Known for its calming effects, chamomile tea may help reduce anxiety symptoms. Lavender. Used in aromatherapy, lavender oil can promote relaxation and improve sleep quality. Ashwagandha. An adaptogenic herb that may help regulate stress hormones. Lemon balm. Often used to ease nervous tension and promote relaxation. Mindfulness and relaxation techniques: deep breathing exercises. Techniques like box breathing and 4-7-8 breathing can help calm the nervous system. Meditation and yoga. Mindfulness-based practices reduce stress and improve emotional resilience. Journaling. Writing down thoughts and emotions can provide clarity and emotional relief. Aromatherapy essential oils. Scents like lavender, bergamot, and ylang ylang can help reduce anxiety. Diffusers or bath additives. Adding essential oils to a warm bath or using a diffuser can create a calming environment. Social and emotional support. Spending time with loved ones. Social connections can provide emotional support and reduce feelings of isolation. Engaging in hobbies. Activities like painting, gardening, or playing music can serve as therapeutic outlets. These remedies can complement medical treatments, but if symptoms persist or worsen, seeking professional help is essential. Stay healthy. If you found this video helpful, please like, share,